I decided that I wanted to be a doctor when I was a young girl, and it became more apparent as I got into high school, and I continue to pursue that dream. The thing I enjoy most about the field that I'm in, taking care of women, is that women, and I'm not being chauvinistic here, seem to take better care of themselves. They work very hard at staying on top of their health care. They take an interest in their overall well-being, whether it is mental or physical. They exercise regularly. We as obstetricians and gynecologists have to balance the care that we're giving to women, because we're seeing women of all ages, from a 3-year-old up to a 99-year-old. And it's challenging to be able to talk to a woman regarding menopause, and then in the next 15 minutes talk to a woman that's been trying to get pregnant for 5 years. So that part I find very challenging. I find it very exciting when that same woman who's been trying to get pregnant for 5 years calls and tells me that she's had a positive pregnancy test. The most memorable patient encounter occurred when I was in medical school. And this was in Chicago at Cook County Hospital at a time when ultrasound was used, but in a limited fashion at that particular hospital. And it was my very first delivery, my very first day on my obstetrics rotation. And the resident brought me into the delivery room, and the lady delivered, and he said, "Oh, the placenta is going to be coming. Why don't you examine the lady?" And I went to examine her, and I looked at him and I said, "Wow, this feels hard, like a head." And there was quite a commotion because there was another baby there. It was an undiagnosed twin. I would describe myself in 3 words. Those would be dedicated. I feel like I am dedicated to the patients that I take care of, and fully committed. I love the patients that I take care of. I am unselfish. I would give my heart and soul to a patient if she needed it. And calm. I try to stay very calm, even if there's a lot of hubbub going on around me. It does not help to get excited or yell and scream. In my spare time, I enjoy running. I have run a couple of marathons. I've run a half marathon, and I just recently ran the Turkey Trot in Dana Point. That is my sanity saver. I do enjoy cooking and reading. I believe our group is different from any other obstetrical group in the area because of the doctors that we work with. I love my partners. I feel very lucky that I work with them. I constantly remark to patients and to other physicians how lucky I am to be with this group of doctors. I feel that our staff, from our nurses to our front desk receptionists, everyone goes that extra mile, and I really and truly believe that that makes a difference.